Hi everyone, my name is Bella and I'm here with my sister.
Hi everyone, I'm Phia.
And we are so excited to welcome you to the very first episode of our podcast, In the Pink.
We honestly can't believe we're finally doing this. This podcast means so much to us, and we're really excited to use it as a way to spread awareness, start conversations, and raise funds for breast cancer research.
Before we get started, we want to give a little background on who we are and why this podcast and our organization exist.
We started Pink Purpose in 2020 when our mom was diagnosed with breast cancer.
At the time, we were only 10 and 11 years old, and honestly, we were terrified. We didn't really understand what breast cancer meant. We just heard the word cancer and immediately thought the worst.
Especially because just a few months earlier, we had lost our father. So emotionally, everything felt really heavy and overwhelming.
At that age, we thought cancer automatically meant death. There wasn't a lot of education around it for kids or teens, and fear filled in the gaps where information should have been.
But once our mom started talking to us openly, explaining statistics, treatments, survival rates, and what her journey would look like, we slowly started to feel more informed and less scared.
And that's really where Pink Purpose was born. We realized that education changes fear into understanding, and understanding saves lives.
Pink Purpose is an organization we started to raise both funds and awareness for breast cancer, especially among young people.
We both play volleyball, and we first got involved through Dig Pink, organizing bake sales, selling t-shirts, hosting events at places like Love Shack Fancy, and really learning how powerful community support can be.
Eventually, we were honored to be named co-youth chairs for the Susan G. Komen More Than Pink Walk, which showed us how youth voices truly matter in this space.
But we wanted to take it even further. We realized that a lot of our peers didn't know much about breast health, prevention, or how lifestyle choices can impact long-term risks.
That's why education became such a big part of our mission and why this podcast exists.
The name In the Pink is really meaningful to us. It means being in good health and good spirits, and that's exactly what we want this podcast to represent.
Which is why we are so lucky to have our very first guest with us today, someone who truly embodies that message.
We are honored to welcome Dr. Starr Mautner.
Dr. Mautner is a board-certified breast surgical oncologist at the Miami Cancer Institute. She specializes in caring for women with breast cancer, high-risk lesions, and those with a genetic predisposition to breast cancer.
We were incredibly lucky to have Dr. Mautner speak at our high school, and after hearing her talk, we knew she would be the perfect first guest for In the Pink.
Welcome, Dr. Mautner. Thank you so much for being here with us today.
Thanks for having me.
So to start, what do you think is the number one message we should be sending to teens and young people about the breast health?
So I think the number one message is to not be scared of your own body and to really understand, the changes that happen obviously during adolescence and teen years where your breasts start to develop, and noting what's normal and what's not normal for you. And if you're unsure, not being afraid to go to your doctor, your pediatrician, or your parents and say, I'm not sure what's going on, I feel something. Knowing your body is extremely important. It is very, very rare for someone in their teenage years to develop something that would be cancerous of the breast, but it's very common to develop benign masses of the breast, especially as they develop in men and in women. And so knowing what your normal is and being able to identify if something is abnormal, just becoming familiar with your body as you start to change.
Thank you. And something we hear a lot among our peers, is it true that things like drinking alcohol can increase your risks of breast cancer? And what are some social or lifestyle factors people should actually be aware of?
So it is true, and I tell my patients this all of the time because people will ask me, what can I do to lower my risk? Or is there anything I did that maybe helped contribute to my diagnosis? And we now know that alcohol is a risk factor for breast cancer, and as little as a few drinks per week can really increase your risk of developing breast cancer and risk of breast cancer recurrence. And so especially in the teenage years where, your bodies are so young and your cells are so, sensitive to things like alcohol, which is a toxin and can cause mutations, I absolutely would say to abstain from drinking alcohol. And as you get older, I would say, you should copy that practice and that habit to really not drink a lot, definitely not on a daily basis and not even on a weekly basis. And I would reserve it for a special occasion. In terms of other healthy habits that you can do to lower risk of cancer in general and lower risk of breast cancer, exercise is really good for you. And we know that in terms of heart health, but also in terms of cancer cancer risk. And so get your 10,000 steps a day. And if you can do even more vigorous exercise several times a week, it really does lower your risk of developing breast cancer. Other than that, eating healthy food, you can try to go purely organic, but that might be difficult to do. But really try to limit the ultra-processed foods. We know that it's linked to colon cancer risk and may also be linked to breast cancer risk as well.
Thank you so much. Another question we get asked a lot, what percentage of males actually get breast cancer?
So male breast cancer is very rare. I see a handful of men each year. It used to be one man a year. Now I see 2 or 3. But really, it only comprises about 1% of all breast cancer diagnoses. And so for a man to develop breast cancer, it's exceedingly rare because men really don't have a lot of breast tissue. They have a small amount of breast tissue behind the nipple, and it's just very, very rare to develop a breast cancer to the point where we don't do screening mammograms on men. That being said, if you are a man and you feel a palpable mass behind the nipple and you think it's new, it's for sure something that you need to get checked out. And oftentimes what it ends up being is benign gynecomastia, which is like a rubbery portion of breast tissue behind the nipple, which is completely benign. But if we're unsure, if there's a suspicious look to it based on imaging, we absolutely will biopsy that mass. And it is possible for a man to get breast cancer. It's just very rare.
Thank you so much. We also wanted to ask some questions that you shared during our assembly when you spoke at our school because they were so important. So Phia can start us off.
So what is breast cancer, and do most masses that are felt in the breast end up being cancerous?
So any cancer is really defined by an uncontrolled growth of cells, and that can happen due to mutations at the tissue and cellular level, and that can be because of either genetic mutations or environmental factors, but it's usually a process of aging and cell turnover, and then something happens within those cells where they mutate and they have uncontrolled growth, and that forms a mass or a cancerous lesion. The second portion of your question was what again? Is every mass a cancer?
Most masses that are felt in the breast end up being cancer.
So the answer is no. Most masses are actually benign. And as I said, especially in young women, it's more common to have a benign mass, something like either a fibroadenoma or a cyst, than it would be to have a cancer. But that being said, the rule of thumb is any solid mass needs further workup and investigation, and usually a biopsy to rule out that it's definitely not cancer. So we usually, in a very young woman, will start with a breast ultrasound. Sometimes we'll get a mammogram as well to further kind of characterize the mass and know whether it's solid or cystic, is it filled with fluid. And as I said, if it's a solid mass, even if it has a benign appearance, we usually will then result to a biopsy to know for sure that it is not cancerous.
Thank you so much. And then at what age do you think women should start getting screening for breast cancer?
So average risk women, so women that really don't have strong family histories of breast cancer, should start by the age of 40 with their first baseline screening mammogram. There are some women that need to start earlier than that. And so an example of that would be if you have a primary relative, like a mother or a sister who developed breast cancer at a very young age. Let's say you have a mother that was diagnosed at the age of 45. Then you actually want to start screening 10 years prior to that diagnosis. So instead of 40, you would get your baseline imaging at the age of 35. Recommendations are to actually start having the conversation of when to start screening by the age of 25. So with your gynecologist or primary care doctor, they should be going over risk factors. Do you have a family history? Were you ever exposed to high doses of radiation? Things like that. And that also can prompt a workup with genetic testing, because if there is a mutation in the family, like BRCA1 or BRCA2, it can put you at high risk of breast cancer at an early age. And those women would start earlier, usually around the age of 25 as well with screening. So it's dependent, but for the average risk women, we start by the age of 40.
And what kind of training do you need to become a breast surgical oncologist?
Lots of training. So I did 3 years of undergrad and 4 years of medical school just because I did a combined 7-year program, but most people would do 4 years undergrad, 4 years of medical school, and then match into a general surgery training program. And so those programs are usually 5 years. And then I did a year of research and a year of fellowship specifically in breast surgical oncology. And so that was my route. And there's a couple of different ways you can get into breast surgical oncology. But if you are interested, I urge you to try to explore that as an option at a young age and know if this is something that you want to dedicate your life to. And if you love it, absolutely go for it. It's an extremely rewarding field. I knew I wanted to be a surgeon at a very young age. I did not know that I specifically was going to become a breast surgical oncologist until sometime during my surgery rotations and my training. But I always welcome having students, either high school, college, or medical students in the OR with me because, that's how I knew at a young age that I wanted to do this. And so if you're interested, absolutely try to shadow a surgeon, see if it's for you. But it definitely takes a lot of training, as it should, but it was worthwhile in the end.
Yeah, that's great. Also, one more question. Two more questions. First, what can people do to be proactive about their health and lower their risks of breast cancer and cancer in general?
Okay, so we kind of already touched on some of those things, like eating healthy, exercising, abstaining from tobacco and alcohol, and those are like the common sense ones that we've known about for a really long time. Other than that, what you can be doing to be proactive is knowing your family history, knowing your risk, right? Do you qualify for genetic testing? And if so, finding, a legitimate cancer institute near you that can do that genetic testing, or at least speaking with a genetic counselor about what you need to be tested for, and then staying on top of your health screening. So we know by the age of 40, you should be getting your baseline screening mammogram. By the age of 45, you should be having your baseline screening colonoscopy. So that age was lowered. It used to be 50, now it's 45. You guys have several years to go, but it creeps up on you, and just, educating your family and your friends, making sure that they're getting their annual mammogram for sure is helpful.
Thank you so much. And I know you also talked about how you let kids shadow you, and I just was wondering, how else can teens get involved, whether it's spreading awareness or supporting a family member or friend who's going through cancer treatment?
Definitely. I mean, I applaud both of you for getting so involved at a young age, and obviously cancer personally affected you, and that's what prompted you to get involved. But there's, breast cancer affects 1 in 8 women. So most people know someone, whether it's a family member or close friend, that was affected with breast cancer. Here in the South Florida community, there are so many organizations. We're so lucky that there are so many different non-for-profits, such as Pink Purpose, Susan G. Komen, and then several of my patients have started foundations such as 305 Pink Pack, Project Disco Ball, Talk Breasty to Me. So I would just say doing some research in your local community and figuring out kind of what calls to you, because you want to volunteer for a purpose that you believe in, something that's fun, something you can get involved in. One of the upcoming events that raises money for cancer patients is called Bounce Back for Cancer, that I participate in for the Miami Cancer Institute. And it's a great event because we partner with the Miami Heat. We raise funds for cancer patients, and we get to dribble a basketball and exercise with the, entire families come out, and patients and friends. And so it's really fun to kind of get involved in the community for a good purpose as well.
Thank you so, so much, Dr. Mautner, for sharing your passion, your time, and your knowledge with us. Conversations like this is exactly why we created In the Pink, and we are so happy we could have you today.
Well, thank you for having me. I enjoyed it, and hopefully it will be helpful for anyone listening or watching.
And to everyone listening, thank you for being part of this community. Awareness saves lives, and education starts conversations.
If you want to support Pink Purpose, spread awareness, or learn more, be sure to follow us and share this episode.
This has been In the Pink. Stay healthy, stay informed, and stay hopeful.
Thank you.